Talk about Boris Johnson yesterday committing to an independent inquiry into the coronavirus pandemic for the very first time. When it starts, we don't know, but could it come actually long before we actually end up getting a vaccine, despite the fact that actually there's a real hope that vaccine trials by Oxford University provide really the best chance now of us seeing a vaccine for the pandemic. Dr. Kailash Chand OBE is joining us now. He's former Deputy Chair of the British Medical Association. Good morning to you.
Good morning, Julia.
Lovely to speak to you. Just first of all, let's talk, can we just briefly about the vaccine? Because I think a lot of people very hopeful of this. And we get a lot of doom and gloom about the economy and death rates and the like. But the fact that Oxford University's trials, led by Professor Sarah Gilbert, do appear to have been successful so far. 1,000 British volunteers have been tested with the vaccine. And they have all shown a double defence, not just antibodies developed, but T cells as well. It's just the phase 1 of the clinical trial, far more trials ahead. But does that fill you with optimism?
Julia, I'm not expert on vaccines, but definitely I think the whole world is looking that a proper or efficient and safe vaccine could be developed sooner. And this is a very long process. It goes through 3 phases, phase 1, phase 2, phase 3. And I think phase 2 has started, and which is a good news. But let's hope that the ultimate tests are very safe and efficient. And I don't think people should raise their hopes that something coming tomorrow. It still, in my view, could realistically take about 6 months.
Well, I mean, again, I think 6 months is better than a lot of people were fearful of, weren't they? Because early on, we were being told normally it can take years for a vaccine to come forward. Of course, a lot of the regulatory frameworks that hold things back, a lot of the licensing, and indeed the huge amount of money that is being thrown at this, but internationally, privately, and by governments, is meaning that we have sort of gone through perhaps a couple of years of the process in just a couple of months, haven't we?
Absolutely, Julia. I think very rightly the resources, the energy, and the brain is actually concentrated on developing this vaccine. And let's hope and wish them best of luck that we get this vaccine as soon as possible.
Yeah, absolutely, indeed. The question is, again, would we get that before we might see an independent inquiry? The government, the Prime Minister, yes, committed that, yes, there would be an independent inquiry. We don't actually know the framework. There are many different kinds of independent inquiries to hold. But it's the first time he's actually confirmed that. Now, you and 26 other leading medics and scientists signed a letter last month calling on him to order that public inquiry to prepare Britain for a second wave of coronavirus this winter, saying, look, it should be sooner rather than later. What do you think we can learn from a public inquiry starting now that we don't already know?
Julia, yes, I think when the history of this COVID pandemic would be written, the chapter on UK would not read very good. I think the headline would be the total incompetence and the failure and the catastrophic shambolic handling of this. We know to date, 45,000 people have died. And just believe, we don't count in this almost 20,000 people dying in the care homes. And me being a health professional, I've been so concerned and so worried about the health professional dying. Would you believe it? ONS only last week released some figures in which we had 540 health workers died in this coronavirus, whereas Russia was perhaps number 1 with 545, and that our figures don't include Scotland and North Wales and Ireland. So believe me, we have really handled this very, very symbolically. And we got to really learn our lessons that we don't repeat what exactly has happened, whether it was a scandal of herd immunity, whether it was a scandal of test and trace, whether it was scandal of inadequate PPEs. And again, I think the leadership, we know what Dominic Cummings did to the whole nation, what kind of role model he was. So we have to really learn our lesson so that in the second wave, unnecessarily people don't die.
Okay, all right. Now let's take some of those in turn. Look, I was very unhappy with what Dominic Cummings did in terms of, if you're part of the people helping to make the rules, you need to be obeying the rules. I doubt very much, though, whether that led to a single death. PPE and test and trace, I absolutely agree with you. I think failures on test and trace, Public Health England were in charge of that, and the failure to sort of government to take charge and say, right, you're clearly not up to the job, failure to order enough PPE to prepare, big issues there. But we also know those are very big issues in a lot of other countries. Emmanuel Macron in France has faced huge criticism over the lack of PPE. We know that this has been across the board. Has Britain been uniquely bad at this compared with other countries? I mean, we often compare ourselves to Germany. Germany is fairly standalone in Europe in terms of their handling of this.
A very good point, Julia. The truth is, look at it. You see, if France has done things wrong, they have already started an inquiry. A court inquiry is already happening in France. And for us, I think we did a simulation, pandemic simulation in 2016. Mm-hmm. And all these PPE inadequacies and the risk related were highlighted. Yeah. And believe me, the so-called austerity and starving the NHS of funding and all that.
Hold on a minute. Starving the NHS of funding. The NHS is one of the few areas of public services that's seen an increasing amount of budget. Now, may not be enough for dealing with an ageing population and a fatter population, but nevertheless, the NHS has not been starved of funds.
Julia, if you go back and look at 31st of January, do you know, and that particular day when the whole pandemic started, we were 100,000 workforce shortage. About 10,000 doctors short, 40,000 nurses, and funding. I think everybody knows that if you look at the history of NHS, the funding was almost every year 4% year on. And for the last 10 years, it was anything around 1 to 2%. So funding was definitely inadequate. And you know how the technology is developing, how the chronic diseases are going on. So we need a lot more workforce and a lot more funding to sort it out.
Okay. Again, I absolutely agree with all those points. I think starving it, given that we were in austerity, it was one of the few public services that actually continued to have increases, even if they were perhaps not big enough. You talked also about the scandal of herd immunity. Again, this has all come about, but from conversations which, I mean, I know the journalist who wrote the original report, it was not a direct quote. It was not something that was actually said by Dominic Cummings. But we know that one of the things that, you know, the chief medical officer and chief scientific advisor were talking about, you know, one of the ways you beat a virus is eventually herd immunity is how it's beaten. It's just there are enough people who've had the virus. It was never official government policy. It was never secret government policy for us to beat the virus purely from herd immunity. It is a simple matter of fact, as you will know as a medical man, that eventually how one beats a virus is through herd immunity. Now, whether that's by enough people getting the infection and surviving or enough people getting a vaccine, that is the only way to beat a virus. So why is it such a scandal?
Oh, you see, again, you know that if lockdown was at least 2 weeks earlier, not many lives would have been saved. You're right. The herd immunity actually is essentially related directly to the vaccine. And we don't have even vaccine yet. Herd immunity is talked about, the measles, the mumps, all those kind of vaccines. Very, very true. But all the policies were allowing now relaxation of the lockdown is essentially, again, getting into it that people will perhaps get it. And ultimately, the community will have this herd immunity. And the truth is, we have to really look into much deeper than the herd immunity, systemic failures, which I think the government was responsible not to look into it and really try and sort it out.
Am I right in thinking you just said we should have locked down 2 weeks earlier? You know, 10 days before we did actually lock down, the SAGE committee, the senior advisors, or, you know, 100 people advising on all different aspects of the health issues here, the SAGE advisors unanimously agreed that it was too early to lock down. And that was 10 days before. You're saying 14 days before. So do you think the government should have ignored all of their medical and scientific advisors, unanimously telling them not to lock down, and should have locked down?
Julia, I think there's been conflicting reports coming off that.
No. The minutes of the SAGE committee report there was a unanimous agreement 10 days before the lockdown actually happened that at that time they should not lock down.
But look at whatever those recommendations were. The truth is unnecessary deaths. How many unnecessary deaths? Look at even your care homes, neglecting the care homes. 20,000 people have died unnecessarily.
Yeah, but could you answer the point I just made? Answer the point I just made. Are you saying the government should have ignored their medical and scientific advisors?
No, I didn't say that government should have ignored it, but the fact still are that lockdown was done.
So the medical and scientific advice was wrong?
I'm not a technical expert on that. Julia, perhaps
well, no, you just said the government should have locked down earlier, and the medical and scientific advice was that they shouldn't have. So you're either saying they should have ignored the advice, or I mean, I don't know what you're saying then.
My dear friend, the whole world knows it. Everybody talks about it, that lockdown was really should have done 2 weeks earlier.
Apart from the medical and chief advisors to the government.
Julia, how many millions of people were allowed to come in the flights?
Well, there weren't millions coming in.
When we know that infection
that wasn't when we were talking about a lockdown. That was in February.
Yes. Again, I think we did not take the proper measures. Why don't you accept that? And the results are here for you and me to see.
Well, I mean, I'm not a medical or scientific expert, so I've just been going on what they're telling us. I don't pretend to be an expert, and I'm just telling you if we're saying that the government should have done something different from what the experts were telling them to do, I'm wondering how much criticism there would be of them for having done that. But we'll have to leave it there. I'm so sorry, we are well over time. But Dr. Kailash Chand, lovely to speak to you. I really appreciate you coming on. He's a former deputy chair of the British Medical Association.